This is Pastor Seth Perry. Today I spoke to Dr. Robyn Henderson Espinoza via Zoom to create some more content for everyone who is social distancing in the ELCIC and elsewhere. This video's goal is to give us Canadians a chance to see the breadth of COVID-19's impact south of the border. Dr. Robyn will handle their own introduction in the video. However, when you're done watching, I want you to check out Robyn's podcast called Activist Theology, and also Robyn recently authored a book of the same name. All of Robyn's info is linked in the video description below. Enjoy, and I hope that you're able to discuss this in your own context.
Hey folks, I'm Robyn Henderson Espinoza, and I'm based in Nashville, Tennessee, below the Mason-Dixon line. You're up north above the Mason-Dixon line, and I'm a scholar and activist. I co-direct a small collaborative project called the Activist Theology Project. I also teach at Duke Divinity School. I'm trained as a theologian and ethicist. I'm also an ordained pastor in the Baptist tradition, and I do work around what I like to say translating theory to action. So public theology is another way to talk about that. And what I do is I just try to talk about faith and values for the public square and help people get their hands dirty to address pressing social concerns.
Awesome. You introduced yourself better than I could, so I think that's
Great.
Great job description too. So I want to start by talking about this. This is one thing that started me thinking about the U.S. and then led to me kind of reaching out to you. I was speaking with my wife about COVID-19 statistics in the United States, and then she said to me, how are these people going to pay for their hospital bills, right? And then we started thinking and talking about the challenges in that with us living in a public healthcare system. So what are things like where you are in the United States and what you know about what's happening in your country? And this being the 26th of March, 2020, this might be sent out to YouTube maybe in a day, but what's it like right now?
Yeah, so where I am in Nashville, Tennessee, we have, I believe, statewide up to 400 cases of COVID-19 or coronavirus. Our hospitals are overwhelmed. I am not on a public health system. None of the United States is. We have privatized healthcare. And just to give you an example of, I pay about $500 a month for healthcare. And of that, if I were to be admitted into the hospital, I would be required to pay 60% of all hospital fees and everything that's done in the hospital. So we are having a public health crisis here in the United States. And if there's any reason for a public health option, the time is now, because this will decimate the working class and the working poor. This will inevitably decimate the middle class, the shrinking middle class. There's no social safety net. And I think we're seeing that very clear right now. I have friends in the public health industry who are aghast at what our federal government is not doing. So things here in Nashville, I don't know about the wider Tennessee area. I know that some mayors are issuing stay-at-home orders, but not every mayor is doing that. As you may know, Tennessee is a Republican-led state. So it means that the welfare and justice for all humanity is not at the top of their concern. What is at the top of their concern is the economy. But in this moment, we don't need to be focusing on the economy at the expense of people. We need to be focusing on communities and communal welfare and how we survive this public health crisis as a community. And unfortunately, our leaders here in the South are not advocating for that.
Yeah. Well, I think you bring up some interesting points, and one of them that my friends and colleagues have talked about when I've had a chance to talk to people. When we talk about the United States in comparison to Canada, is we start thinking about groups that are already oppressed, and how it seems that a private healthcare system what effect will that have on them? So groups that are oppressed, who are they, and why is it that those people, those marginalized peoples, will be affected by these the inequity in private healthcare?
Yeah, when I think about this, I mean, I think most closely is my girlfriend, who will be impacted by the privatized healthcare system. My girlfriend does not have health insurance, and so people who are without health insurance will be most impacted, and that is largely people of color. I also think about those who are incarcerated or those who are seeking asylum, who don't have access to communal care. They will be negatively impacted or disproportionately impacted. And the reality is that we have created an unsustainable, an unlivable situation here in the United States, and it's breaking down. And I think we're seeing that we are being confronted with that. And you talk about inequity, progressive movements, progressive Christian movements, they don't know how to talk about sin. And so when I think about inequity, I think that this is sin. The ways in which we have not provided for the least of these,
Mm-hmm.
that is sinful.
Wow.
And simply put, we have to do better.
Yeah. Wow. I think that's a powerful statement. I think it holds so much truth in this specific moment in history. I think it's great. And it leads into my next question. Looking at the church, how should those who follow Christ, how should anyone, regardless of whatever political affiliation you identify as, if you call yourself a Christian, those who attend churches, how should people who identify as Christian respond to what is happening as a result of the virus, specifically in the United States?
Well, I think that this is a moment of lament and pain that we're seeing, that our social fabric is changing. Not only are we sheltering in place, I'm going on 2 weeks now sheltering in place. Not only are we at home, isolated, and physically distancing, but we are seeing the social fabric of our culture shift. And if we do this right, we will create a profound culture shift. But if we do this wrong, we will just go back to the same machinations that causes oppression and an unsustainable life. And so we really need to be paying attention right now. And we really need to be focusing on how do we create folds of solidarity in the midst of physical distancing. It's why the Activist Theology Project is hosting things like Coffee Hour with Dr. Robyn and Front Porch Gatherings on Thursday. And somatics class on Sunday. We have to respond in a responsible manner so that we shift the culture in a way that creates sustainability. And if we don't, it will be a failure in this vision of humanity.
Mm-hmm. So my last question, when thinking about the United States, I often think about some of the things that we see in pop culture and in the media as Christians are represented. And so in a context like yours, where the national identity has been interwoven with Christian fundamentalism, and it's quite evident when you look at the media, that's where there's a lot of representation of Christians as patriots or nationalists.
Right.
Then when we're looking at praying for a whole country of people like the United States right now, when Canadians gather for prayer, or Americans are thinking of praying for their country, how should we respond to what is happening in prayer without being nationalists and patriots? Like,
Yeah.
what is when we're thinking about just prayer, how do we do that in a way that that's compassionate in a way? So what do you think about that?
Well, I mean, I think a lot about that. And I think the first thing I'll say is that we all need to remember that white supremacy and Christian supremacy share a parasitic relationship. They feed off of each other. And so you have this sort of nationalistic orientation to a fundamentalist faith, Christianity, and that is in bed deep with white supremacy, and that is creating a superior culture and life for white people, and that shows up in Christianity. And so we first need to be just mindful of the parasitic relationship that supremacy culture breeds, and that unfortunately here in the United States, Christian supremacy, fundamentalist Christianity has taken a foothold in such a way that it's killing people. So my girlfriend and I, we are praying at least 3 times a day each time we eat, and we're just holding intention. We're holding intention for those who don't have access. We're holding intention for those who are hearing the news. We're holding intentions for those who are sick. We are lamenting the pain. And I think that, we all need to be just holding psychic space and heart space, whether we call that prayer or whatever we call that. We need to be holding some sort of heart space for those most impacted by the coronavirus. And I think we also need to be asking one another, how do we survive this when at the federal level we don't have any leadership? Mm-hmm. And this is where I think faith communities can come into play in helping shape the narrative that comes out from communities. How might a communal response impact the more negative narratives or toxic narratives that are coming out right now?
Mm-hmm. Wow. Well, I really appreciate you taking the time today to discuss this.
Of course. Sure.
Super meaningful for me. If anyone's watching the video and they want to be able to follow you, how would they be able to do that?
Yeah, so I am on all the socials, so Instagram, Twitter, and Facebook, and I am iRobyn on Instagram and Twitter, and that's the letter I, ROBYN. And my Facebook page is Dr. Robyn Henderson Espinoza with a Z, Z-A. And would love to hear from folks north of the Mason-Dixon line. I have a good friend in Alberta, and we're keeping in touch, and love that I can contribute to good theology and practicing faith and action.